concept of brain health entails or includes several aspects. One aspect that I like to stress much in my communication is the concept that we can do a lot to prevent neurological diseases from early on in childhood up to adult life. A healthy diet, protection towards head trauma, or exercise, physical exercise, or cognitive exercise at all stages of life.
There's a huge overlap between what we see as neurology or neurological disorders and what we see as brain health. In my mind, I look at these as Venn diagrams with substantial overlaps. So for example, when you're thinking about a brain health, it doesn't automatically, you don't think about spinal cord. But I believe these are artificial boundaries because we know there are so many comorbidities.
I think we should look at the brain as one organ that can become sick, like the heart can be sick, the stomach can be sick, and raising awareness on these type of disorders and getting the message across to the lay public as well that it's totally normal to have disorders of the brain. Why should it be okay to have a heart disease and should be stigmatized to have a brain disease? So once we start having this conversation about the brain as a one organ that is part of our body and can get sick, I really think we will have progress from the research point of view, from the awareness point of view, the societal conversation. So I think it's extremely important.
The most valuable 3 pounds in the universe are our brains. And we act through the brains. We're shaped by environment and we shape the environment. So there's nothing more important than having health. And so I think the whole idea is to invest in brain health, which is the ultimate wealth, making sure that it keeps as functional and as effective for as long as possible.
Neurological disease is a core issue in brain health, but I think it's important that we advocate that the brain is a whole, because neurological disorders exhibit psychiatric symptoms and vice versa. And rehabilitation measures, pediatric patients, spinal cord injury, it's all a whole.
There needs to be a mass movement around brain health. And, that's both research to fight and understand and treat brain diseases, but it's also diet, exercise, social interaction, all of those things that I don't have to be a scientist. I read enough in the mass media to know that those are helpful in at least slowing the progression of many, many brain diseases and other diseases.
Brain health, in my view, is a simple way to introduce the topic of neurological disorders and neurological disease. Everybody understands what the brain is. They don't necessarily know what neurological disease is. So if we talk about brain health, once that's understood, and what was also understood is that brain ill health results from neurological disorders, then I don't think you're going to lose one or the other.